Hello, my dear doctors. Welcome back to Conquer Pathology with Dr. P. Today, we are diving into the war room of the human body. We are talking about immunopathology. This unit is the bridge between basic science and the medicine you will practice in the wards. Whether it's a patient sneezing from pollen, a young woman with a butterfly rash, or the global challenge of HIV, it all starts here. I have broken this lecture down to cover NMC competencies PA 9.1 to PA 9.7 in detail. We will connect the dots with medicine, pharmacology, and microbiology, so you don't just memorize this, you understand it. Grab your notebooks, we have a lot of ground to cover. First, PA 9.1. What is immunity? It's simply protection from infectious disease. Think of your body as a fortress. It has two lines of defense: innate immunity and adaptive immunity. Innate immunity is natural or native. This is your always on defense. It's the police force patrolling the streets. It has no memory and no specificity. It treats every intruder the same. Its components are physical barriers like skin and mucosa, the fortress walls, cells like neutrophils, the rapid response foot soldiers, the macrophages, the heavy tanks, and natural killer cells, soluble proteins, the complement system, and acute phase reactants. If a thief enters a bank, the security guard, that is your innate immunity, tackles him immediately. He doesn't ask for ID, he just stops the threat. The next line of defense is adaptive immunity, which is acquired and specific. This is the SWAT team. It takes time to mobilize, from days to weeks, but it is highly specific and has memory. Humoral immunity, B cells. It is mediated by antibodies IgG, A, M, E, D. It targets extracellular microbes like bacteria in blood. Cellular immunity, T cells. It is mediated by T lymphocytes and targets intracellular microbes like viruses, TB. CD4 plus helper T cells, the generals. They don't kill, they shout orders. That is, they release cytokines to tell everyone else what to do. T helper 1 cells activates macrophages, causing cell-mediated immunity. Th2 activates B cells and activate humoral or allergy. Th17 recruits neutrophils and cause inflammation. CD8 plus cytotoxic T cells. They are the assassins. They directly kill infected cells.